Hey guys, we are Team 10 and our topic is Vax-The-Nation. This is Harshal Waza, Meera Daya, and me. So, what's Vax-The-Nation? What's our project about? So, it's about fighting COVID 19 using social network theory. So, we all have been living through COVID the last year. The death toll has passed $400,000 and it continues to rise with no answer in sight. So, some of the assumptions that we made here is that the COVID 19 or R naught or the reproduction number is still above one, and that the vaccination efforts aim to bring it below one. The frontline workers and essential workers, senior citizens have all been vaccinated, so there's essentially no wait list. And a government survey indicates that 50% of the individuals who took the survey are not willing to get vaccinated. So so this was the problem that we identified. So more than COVID, now we have the vaccine, but what? More than 50% of your population is not willing to take it. So this is as big as dealing with a pandemic. So once we have the problem statement, we define the problem statement as how do we want to optimize and maximize vaccine readiness or increase the willingness of people to take the vaccine. We want to influence this 50% who are not willing to take it right now. And why is it important? Because these vaccines are limited in supply, the holding cost is very high, very expensive, and the risk of the vaccine becoming useless is always there because it has a very low shelf life. You might have all read in news how a big ton of vaccines got wasted because they were not stored or maintained at the right temperature. So, what do we plan to do? The proposed solution is to develop an alert system similar to Amber Alerts and notify select individuals of vaccine availability. And how do we select these individuals? We'll get more to that in the next slides, but we want to identify individuals who are willing to get vaccine and have a very high social degree. This can maximize or optimize vaccine delivery, and we can reach as many people as possible. Mira, the next slide, please. Thank you. So just a little background on how we got here. We began researching with the data set that we got from Data 360. And when we plotted a simple word cloud, we saw that some of the most pressing issues or some of the most important pain points revolved around COVID, the vaccine, the lockdowns. So we trimmed or extended our stop words to see what are the more pressing issues. And as you can see in the word cloud, vaccine is like the biggest issue, biggest point that everybody was talking about. Next slide, Mira. This is just a basic Google trend search over the timeline from March till now. So you can see how things have, how the trends have progressed. Initially, it was all about people were talking about what's COVID-19, and then as towards April to June, when everybody was in a lockdown, people were discussing Zoom, cut to December and January. Now we're discussing vaccines. So this kind of ties back to the data we had. So Google Trends also ratify the fact that everybody is discussing vaccines, but not necessarily in a positive way. It's not discussion doesn't indicate willingness to take the vaccine. Can we go to the next slide? Here's a simple statistic that we put together based on some of the data that we collected. As per a recent news survey, recent news report, 156,000 vaccines were being thrown away. These vaccines are time and temperature sensitive, and any delay in using them just results in being them thrown away. So this is not just vaccines that are going waste. This is months of R&D, billions of dollars in research, and the potential for herd immunity that we are just throwing away. So every second counts. So from here, we came up with a problem statement that we want to improve or increase the willingness of people to take the vaccine. We do not want 50% of the population not taking the vaccine and not achieving this herd immunity that the government really wants to. Next slide. So we began researching for other data sets which can probably point us to, okay, what kind of people or what demographic of people might be more interested in taking the vaccine. So the very next thing we looked at was a flu data set. This was of Kaggle, and you can see some visualizations here of that data set. These graphs show us the willingness of people to take a seasonal flu vaccine by different demographics like age, the household size, the number of children in the household, the employment status, etc. Overall, at an aggregate level, only 40% of the population showed willingness to take the flu vaccine. So if we assume the same numbers for COVID, reducing R naught is going to be super challenging. So how do we maximize willingness in this case? Our answer, social network theory. So what's social network theory? It's, to put it simply, it's based on the basic premise that birds of a same feather flock together. The fundamental concepts of virality, degree, and centrality can help us understand how social networks work. These metrics help us understand how communicable diseases like COVID spread in the first place. So we thought, why not re-engineer the same concepts and apply them to increase the willingness of people to take vaccine? On this slide, you see this 50 people social network where each person is a node. So we begin by ranking individuals based on the decreasing order of their degree and centrality. So what's degree and centrality? To keep it simple, degree is the number of direct connections a person has within a network. And closeness centrality is within this network, which people or which nodes are best placed to influence the network quickly. So we're going for two things here. One is the reach, two, speed, sorry. So once we identify these and we rank the individuals, we target individuals starting with the highest rank. So for example, why we want to do this, for example, if my uncle gets vaccinated, then there is high likelihood and probability that I might be willing to take the vaccine. So we are resting our assumption on this premise that if your network, if people you're closely connected to in your network take the vaccine, that will increase your likelihood to take it. Now the idea is to target people, to identify these people and target them. If you notice on the graph, targeting the right individual will increase the way information or increase the way virality spreads in the network. So we are able to influence the entire network in 8 days here. So approaching the right person can not just maximize the vaccine willingness, but also the time to delivery, which is very, very essential. Next slide, please. Okay, so Mira, I think you jumped a slide. Yeah. So this is another graph. This is based on a subset of our data set and identifies individuals based on high closeness, centrality, and degree. Again, as said, so these people are important because this way, identifying the right individuals, we can influence the entire network and influence it faster. So the green and purple dots you see here are the people who have very high degree and centrality measures, meaning they can influence the network quickly and widely. So health authorities can identify such individuals or called key entities and influence the community better. We might be able to contact them, send them the alert and send them to the nearest place with extra vaccines and have them take it. And then this process in turn influences the entire network. Next slide. So coming to our solution is to develop an alert system similar to Amber Alerts. Users will enable data sharing and location sharing through their phones, which will then allow us to identify people and send alerts to. This will also give us additional information of demographics and location, which we can feed into our model and enhance it and enhance the overall effect of the network. But this does come with its own set of assumptions that people are willing to share this data, demographic and location. Both government has a means to send alerts, and assuming that there is no other knowledge of the unused vaccines and that we can get instant information about the vaccines. So once we have the required data and information at hand, we can identify individuals with a high degree and centrality and send in these alerts. On this slide, you can see this sample. This is a real alert that we receive in California that's currently in place in California right now. If you register to take the vaccine, you get these alerts based on when you can get it. So we are trying to go for a similar thing, go for a similar alert, which will notify individuals if there is vaccine availability nearby based on the location and say, there is vaccine availability in 2 mile radius to you. Would you be willing to take it? So that's all. I think through this project, we aim to connect people with vaccine and vaccine with people. So thank you so much. And I open to questions.